Let's take a look at world lithium production for 2009. Got it here. It looks like it was about 450,000 tons produced that year. Lithium is a hazard classification number 9 from the CFR and UN code 3481, which means caustic substance. So it is a hazardous material regulated for when transported or handled. Lithium is also utilized as a treatment for maniac behavior, bipolar, things like that. So let's see what we've got here. So it's for the oral routine, which is how it's used when prescribed for the treatment of schizophrenia, bipolar, or other psychotic diseases that are diagnosed and treated. They will utilize lithium. Lithium toxicity is closely related to serum lithium levels and can occur at doses close to therapeutic levels. So a therapeutic level would be what you prescribe to somebody with schizophrenia or bipolar, or that's diagnosed with one of those diseases or other mental illnesses. Facilities for prompt and accurate serum lithium determination should be available before initiating therapy. Okay. Side effects. Along with its needed effects, lithium may cause some unwanted effects. Although not all these side effects may occur, they do occur. If they do occur, they may need medical attention. Consult your doctor immediately. Confusion, poor memory, lack of awareness, fainting, fast pounding or irregular heartbeat or pulse, frequent urination, increased thirst, slow heartbeat, stiffness of the arms or legs, trouble breathing, especially during hard work or exercise, so a COPD-like symptoms. Here's a picture of lithium right here, the typical pill. Unusual tiredness or weakness, almost like a multiple sclerosis type deal. The stiffness in the arms or legs, so it's going to be mimicking MS with COPD or asthma symptoms, and some weight gain, so your thyroid won't be working correctly in your metabolism rates. So rare, lack of oxygen absorption into the blood, so it's a blue color, or pain in the fingertips and toes, coldness in the arms or legs, so circulation issues, back to that heart irregularities, dizziness, eye pain, headache, noise in the ears, tinnitus, vision problems, incidents not known, blurred vision, burning feeling in the chest or stomach, chills, cloudy urine, cough, decreased urination or increase. So this is back and forth. You can have one or the other. Difficulty in speaking, so dyslexic type symptoms. Drooling, so you have lack of sensation, or dry mouth, one or the other. Eyeballs bulge out of the eye sockets, fever, flush, dry skin, fruit-like breath odor. And what that is, your cerebral fluid, cerebral fluid is actually got a lot of glucose in it. It's part of what your brain runs on. It's not a salty fluid in your spinal cord or your brain. It's a glucose heavy fluid. And so the fruit like breath or odor comes from leaking of your cerebral and spinal fluid through your nasal passages. General feeling of illness, increased heart rate, increased hunger, increased urination, indigestion, irregular heartbeat, again, large hive-like swelling on the face, eyelids, lips, tongue, throat, hands, feet, so edema or genitals, lightheadedness, loss of balance, loss of strength or energy, muscle pain and weakness, again the MS type stuff, wrinkled skin. We're not going to go through every single symptom, but I want to get some of them. Symptoms of an overdose of lithium: blurred vision, clumsiness or unsteadiness, so your balance, convulsions with seizure, diarrhea, drowsiness, increase in the amount of urine, lack of, this would be the edema in your organs getting pushed into your bladder and being excreted as urine, lack of coordination, loss of appetite, muscle weakness, nausea, ringing in the ears, tinnitus again, slurred speech, trembling, severe trembling, so like Parkinson's, an overexposure or buildup of amounts of lithium in your body, vomiting, one's not requiring acne, bloating, changing or loss of taste, the common head trauma issue. So when you have a traumatic brain injury, this will happen. Decreased interest in sexual intercourse, diarrhea, drying and thinning of the hair, so lack of your body's glands to be able to deal with DHT, full feeling, let's keep going, nervous system, drowsiness, lack of coordination may be signs of lithium toxicity and may occur at lithium levels below 2 million EQ per liter. Ataxia and giddiness occur at levels above, so your brain's kind of cooking, and we'll watch what lithium looks like. Okay, here's some more detailed information. You can see the website address up here, drugs.com. The endocrine system, very interesting. Let's go to the next page. 7 things you should know, how it works. Lithium may be used to treat mania associated with bipolar disorder. Experts are not sure exactly how lithium works, but believe it alters sodium transport in the nervous and muscle cells, which adjust the metabolism of neurotransmitters within the cells. Lithium is an element found naturally in the environment and in our bodies. Lithium belongs to a class of medicines known as anti-maniac agents. Upsides: may be used to treat manic episodes and manic depressive bipolar disorder. Long-term therapy with lithium prevents or diminishes the intensity of subsequent episodes of mania. Non-habit forming and is not abusable. It is not a controlled substance, as here, not a controlled drug. It has risk for pregnancy and lactation, so breast milk production. It's available by prescription only, and it has the history here for approval in the United States, which I'd like to see if this was approved. Okay, so it was actually approved a little bit after the high point of schizophrenic research that was conducted in the 60s by guys like Carl Rogers and others. Carl Rogers would be a person that is worth looking into if you're interested. He developed some pretty neat therapies or techniques and experiment, kind of a researcher more than anything, so he's got some great writing. Generic lithium is available, so it's a cheap drug, apparently. Downsides: boop boop, find hand tremors, nausea, diarrhea, may also cause irregular heartbeat. Yep, there's a lot of, this is all the same stuff we already looked at. Bottom line, lithium may be used to treat manic episodes associated with bipolar disorder. However, there is a fine line between too much and too little, and ongoing monitoring is needed to prevent lithium toxicity. 5 tips. Lithium is usually taken 2 or 3 times daily with food. There's a fine line between too much and too little. If you miss a dose of lithium, take it as soon as you remember, if you can remember. Do not crush or chew extended release tablets. Swallow whole. Too much caffeine may decrease the amount of lithium in your body. Well, this is just a nice thing to note. If you like coffee and you're worried about lithium levels because you're not somebody that needs to be prescribed this, common medications that may interact with lithium. And here's a list. So again, this is, and any NSAIDs such as ibuprofen, naproxen. Okay, next page. So that's medical advice. Again, this is on drugs.com. Just click on your tabs if you want to do some more research here. But let's get out of the medical aspect of it. I just want to get the amounts. Okay, we're going to skip this